For professional advice with a personal touch, consult F.L. Fuller Landau, Chartered Professional Accountants and Business Advisors. Click on flmontreal.com.
7:06. Welcome to today's Entrepreneur, a program about the entrepreneurial spirit that drives Quebec business. My name is Dan Delmar, along with FL Montreal's Josh Miller. Good evening, Josh.
Hello, Dan.
And this evening, we're going to talk about the medical profession with a couple of doctors who decided to go private.
It should really be interesting. You know, we probably won't have enough for the hour that we have, and we'll try and get a couple of stories out of them. But, you know, going from the public system to the private system, you know, that two-tiered aspect that everybody's familiar with. Very interesting.
Dr. Andrew Steinberg, he's a urologist, and dermatologist Dr. Roni Munk will join us on the program in just a few minutes. But first, as usual, some news and notes. And later in the show, also, by the way, FL tax partner Nick Moraitis on some tax implications for doctors and other professionals, of course, this season. But first, some news and notes, as we usually do at the beginning of every show. And first, my entrepreneurial question of the week, Josh, is actually via my dad. So I'm in a couple now, and my girlfriend is also an entrepreneur in a sort of a complementary field. She's a speech therapist. So once in a while, you know, we cross over, and if there's a problem...
Do you collaborate?
It's happened. If there's a problem that I can't fix, if it's a medical problem that I can fix in a media coaching session, for example, I might go to her and ask for some help on the medical side. But my dad suggested that because we are in these sort of fields that are a bit complementary, hey, why don't we start another business together, a side venture? And to that I said, I don't know. So my question, just based on time, I mean, not because it wouldn't work, but my question for you is on the personal side, what are some of the more common mistakes or sources of tension you've seen with entrepreneur couples?
It really starts with, what is the relationship you have together? Do you have an open relationship? And I don't mean open. I don't mean open from, you know, can we sleep around, of course. That's not what I meant. And I'm sure the listeners don't want to know that. No, but do you have an honest relationship? Can you work together? Do you keep secrets from each other? Are you willing to share information? Do you have the same mentality? Do you have the same business mentality? Do you have the same, whether you give to get, whether you're closed, whether you really delegate, whether you don't delegate? But the other aspect is, are you putting everything under the same roof, or you're truly separating the businesses? Some will say that, hey, you know what? One company, it's easier. It's from an administrative standpoint, another. Let's throw everything under one. Yes, from an administrative standpoint, possibly from an economies of scale standpoint, it's okay. From a liability standpoint, not so good. If one business tanks and the other one flourishes, it's okay, so losses will be absorbed by gains. But then are you creating animosity? Are you saying my business is doing better than yours? So it is tough. And the other aspect is, do you bring your business home every night? Do you bring it home every weekend? And there is, forget a danger. It's going to happen. It is going to happen. If you can live with that, if you don't mind taking a chance with that, great. If you can't live with that, don't start down that path. Or at least go into it and say, you know what? We're going to try it for 3 months. Works great. If we don't, we are putting blood on paper saying we're separating the business and not doing it again.
All right. Thanks, Josh. Appreciate the advice. Also, news and notes of the week. Let's go to this story. This is the City of Montreal. They're going to start throwing some money at local startups here.
$1.3 million. So it's a lot of money, but it's not a lot of money. They claim that there's hundreds of millions of dollars that are being brought to the economy by startups. People in the Quebec business world knows that Montreal is a huge startup community. We talk about tech all the time, whether it's artificial intelligence or what have you. We talk about all these different startups. Every week we have a business that has been around, yes, some for decades, but some for just a couple of years, which is in many respects pretty much a startup. So Montreal has said, you know what? Okay, we're going to put $1.3 million into this. They're backing this startup festival, which is here every year and growing each year. It happens I believe it's in July, mid-July, and the startup community in Montreal is big. It's growing. It has a voice. So I understand that aspect of it, certainly from a Montreal vantage point. But there was another article that was from a federal vantage point. And, does Ottawa contribute to the business community, to the startup community? Do they know that there is money in the economy that is going to grow as a result? And I would say yes, they're putting in a chunk of money, $3-4 billion into the economy from a startup standpoint. However, what are they not doing? That it's not what they're doing so much as what they're not doing. And are they really creating laws or putting in rules, regulations to retain talent? How many times have we heard we have great universities, we have great systems? Look at McGill in the medical aspect. Great venues, great universities that can pump out great doctors, but do they stay? That's the question. How many times, Dan, have you heard or have you spoken about the brain drain from whether it's Quebec, whether it's Canada? There's far more opportunity. The pay is greater, south of the border or outside. And I'm not so sure the governments, whichever level of government you want to talk about, realize are doing anything about it.
Yeah, I've seen it here at CJAD. I mean, running an internship program, and eventually a lot of young, talented kids just want to go elsewhere. And we needed a strategy for that. And
what is it? Is it giving tax breaks to people for them not to go? Is it charging more for school here, or charging less for school? But if they leave the province, the country, they have to kick back to the province. I mean, who knows what the right answer is? But there is definitely some type of brain drain that is going to continue to happen, and we're going to talk about doctors. We're going to talk, we spoke last week about, or a couple of weeks ago, about doctors and how, or professionals, and how there's, with the changes in the CRA and the Bill Morneau aspect, and are they really attracting small businesses here? They're not, but it's so much more cheaper, certainly with Donald Trump's tax reform down in the States. So they've got to find ways to retain talent.
Last time on the show, we spoke about Juliette Chocolat, and now another Quebec-based chocolate success story.
And this one, this story is really more, and doesn't matter the name at the moment, but this story is real about being vertical. This story is about two things. One is being vertical, and one is giving a reason for somebody to walk into the store. We've said that a lot. Why walk into the store? Give me a reason to walk into the store. Be different. Be unique. Be attractive. Be something. Have that right attitude towards customers. Have the right differentiator that's going to walk you into the store. So they are doing more liquid chocolate than hard chocolate, if I can say that. So liquid chocolate that, certainly there are many uses for liquid chocolate, but we won't go into all of them right now. But that's certainly an attractive feature. But even more importantly, they're really looking at it from a vertical standpoint. And that's what I wanted to stress about the article, is this verticality of a business. It's not just the retail. It's where they're getting their chocolate, where they're getting the flavors, where they're manufacturing it and bringing it all the way up to the retail chain. And that's really where you can make even more money than you would expect just from a retail perspective.
This story is helpful from Inc.com. 3 questions you need to ask before starting a business, according to a top entrepreneur. This is by Tommy Mello. And number 1 is, how can we bring to the consumer a unique product or service? Sounds pretty obvious, but...
And really it comes back to the previous story. It's what's the differentiator? It's not so much what that product is. It doesn't matter what, but it's how can it be slightly different? How can we get it to you? How can we make it a little more unique? And I would say there's a lot of companies out there that want to over-diversify, that want to be all things to all people. I say, you know what? If you can do that, great. But chances are, if you can do one thing superbly, magnificently, and do it phenomenally well, you're going to attract probably more people and create that niche for yourself.
Number 2 is, how can we bring this product or service to the consumer more economically?
And again, it's not so much about the product or service. Everybody needs certain aspects, whatever it might be, but can they get it to you? Certainly in today's world where it's a lot online, it's a lot of competition. Go onto Amazon, eBay. There's so many areas that you can get things a little cheaper. How can you bring it there more economically? But it's not just about the price itself. It's about everything that surrounds it. So yes, I can buy a mouse for less money somewhere, but if I get it and it comes, it's a fantastic mouse and it comes with all these features and I don't have to think about other things, I don't have to add on plugins or anything like that, well then that is something that could be more interesting.
And finally, how can we bring this product or service to the marketplace more conveniently?
Minimizing the pain points. It's all about minimizing pain points. If you don't struggle with buying something and it's so much easier just to click and purchase or walk in a store and purchase, that's the key. Minimize your pain points. Get your product out there.
All right, we're going to talk about doctors, professionals, and tax strategies for them later in the show. But first, we'll start by profiling urologist Dr. Andrew Steinberg and dermatologist Dr. Roni Munk. They are both up next on CJAD's Today's Entrepreneur.
For professional advice with a personal touch, consult FL Fuller Landau, Chartered Professional Accountants and Business Advisors. Click on flmontreal.com.
7:20, welcome back to today's Entrepreneur, inspiring stories from outstanding business people. Dan Delmar and FL Montreal's Josh Miller with you. And joining us on the program this evening is urologist Dr. Andrew Steinberg and dermatologist Dr. Roni Munk. Dr. Steinberg, Dr. Munk, welcome to CJD.
Thank you.
Thank you.
Happy to be here.
It's like young doctors. Doctor, and doctor.
Welcome back to Dr. Munk, by the way, whose show Skin Deep is on CJD Wednesday at 7 p.m. with Kelly Alexander, so stay tuned for that. But to start, guys, can you just tell me a bit about your practices, starting with Dr. Munk?
Sure. So I'm a dermatologist. I've been in practice now for about 6 years. It's been a year that I've been in private practice. And my practice is really a mixed medical cosmetic dermatology practice. So if you've been to the clinic, I have a lot of technology. I do a lot of laser surgery. So removing, skin lesions, cancers with lasers is something I do on a day-to-day basis. I also do a lot of cosmetic work, specialize especially in injections using Botox and fillers, and then using lasers to also improve quality of skin, and treat various conditions like acne, rosacea. So that's pretty much my practice in a nutshell.
Everything that has to do with skin.
Anything skin.
Go see Dr. Munk.
Skin, hair, and nails.
Skin, hair, and nails.
Yeah.
Exactly. Everything that grows.
Except for penile skin, then you can send them to me.
That's true.
Perfect, Andrew. What a segue.
That's my segue.
It's a great segue.
I'm a urologist. I've been in practice for 15 years. This is my 15th year. My initial expertise was in the area of minimally invasive surgery, laparoscopy. Gradually, I've changed to more office-based practice, and I've been private for the last 4 months. That's something that's changed the focus of my practice, dealing with many issues within urology: prostate disease, benign and cancerous, vasectomies, sexual medicine, penile disease, female incontinence. So it's a whole slew of urological issues that we deal with in the office.
All the fun stuff, no doubt.
All the fun stuff.
So, here I am thinking that I was going to, wait till later in the program and get this. But, there's the burning question. You said you switched to private 4 months ago. Ronnie, you mentioned it was about a year ago. So I'm really just going to jump out and say it. Why? Why did you go from the RAMQ, the public system, to private practice? Ronnie?
I mean, for me, it was a easy, smooth transition and an easy decision to make. Only because, I studied, I did a fellowship in laser surgery, and laser surgery is all private. So even when you treat acne, rosacea, skin cancer, which are medical conditions, when you treat those with laser, it's already a private procedure. So when I was on RAMQ, my patients were confused. I was confused because, some of it was on Medicare. Some of it was considered, more cosmetic.
So the cosmetic stuff absolutely was off of Medicare.
It was off
had
Medicare.
to be done essentially privately.
It was. So it was really a mixed kind of system. And then, last year, the government made it very clear that they didn't want this to happen anymore, and you couldn't have this mixed, some bills, some Medicare, some private.
And I guess it's confusing to the patient, to the client as well.
It's confusing to me too. So if I'm confused, I know everybody else out there is confused. And so because of that, I decided to go private. The other aspect also is that I wanted to run my practice a certain way. I like to spend time with my patients. I like to do full skin checks. I like them to be able to ask me all their questions and concerns without rushing them out of the office. And I did feel that going private would allow me the time to do so.
Dr. Steinberg?
So some things similar to Ronnie, other things very different. In urology, there's not many aesthetic procedures, obviously, and there's not many.
There could be.
There could be. We'll get into that. And there's so I wasn't doing any aesthetic procedures, which were not covered, but we were doing procedures in the office: cystoscopies, vasectomies, circumcisions. And this was offering a good service to patients that was taking years or months to get done in the hospital. So many urologists were doing this, but with the change in the laws a year ago with the accessory fees, we were no longer able to do these procedures. So it sort of forced my hand to say, do we stop this? Do we stop offering the services to the patients and close the office ultimately and go back to the hospital full time, or this, go private? And this is, again, dramatically affected my practice, the way I deal with my patients, because we were based on volume. 10, 12 patients an hour, 5 minutes, in and out, in and out. And we obviously deal with a lot of sensitive issues below the belt. 5 minutes is not enough for most of these patients, for all of these patients, and it's not the way that I wanted to deal with them. So this gave me a chance to really, as Roni said, spend the appropriate amount of time with the patients and treat patients the way I would want to be as a patient myself.
So you open the private practice. So why stay in Montreal altogether?
Montreal's a great city.
I agree with you. Just wondering.
I love Montreal. I mean, families here. I think we're both from Montreal originally, so for me it was an easy decision. I always wanted to stay in Montreal. I actually think that that's one of the strongest aspects of Quebec, is that there is private medicine here, and patients have the option to go private if they want, and it's not like that everywhere in Canada. I think Quebec is one of the more liberal provinces at that, and I think it's a plus.
So you think the two-tier system works here?
I do. I think, obviously there have to be restrictions on it, which there are. But if it's, well done and applied properly, I think that it could work. I think the private system can relieve some of the burden on the public sector. And I think it gives patients that option to go private if they really feel the need to do so.
When you're going into the private from the public sector, are you now starting to elaborate and think, what other services, what other things can I do for patients that can go well beyond what I would have otherwise done?
For sure, because I'm learning by the patients who are coming to see me why they're coming to see me, and they're not able to get GPs to get a referral to see the doctors, or they have certain problems that they want to elaborate on, which doesn't best fit the public system. Again, the public system has to be strong. It's crucial. But no matter how strong it is, there's still going to be some delays. And for certain people, that's too much. Living with X problem for a week may be okay for you, but someone maybe want to be seen today because they're going crazy with whatever the issue is and want to take care of it as fast as possible. So we're always looking for I guess it's the same thing with you. We want to best serve the people out there and see what the needs of the people are and how it best fits in with our own practice.
So all about service. When we come back, we're talking even the business side of it, the marketing, the people. There's so many other aspects of technology, as Roni was referring to before.
We're speaking with a couple of doctors on their transition from the public system to the private system and their businesses, urologist Dr. Andrew Steinberg and dermatologist Dr. Roni Munk. This evening on Today's Entrepreneur, we'll have more with them, plus Nick Moraitis on their tax implications. It is tax season after all. That is all on the way.
For professional advice with a personal touch, consult FL Fuller Landau, Chartered Professional Accountants and Business Advisors. Click on flmontreal.com.
Welcome back to Today's Entrepreneur, a program about the entrepreneurial spirit that drives Quebec business. My name is Dan Delmar, along with FL Montreal's Josh Miller. And this evening we're speaking with a couple of doctors who recently decided to go private, urologist Dr. Andrew Steinberg and dermatologist Roni Munk. And Mr. Munk, Dr. Munk, can be heard on CJAD coming up on Wednesday at 7 p.m. for the Skin Deep Show. And guys, let's start with you, Dr. Steinberg. Why did you decide to go private?
So it was a decision long in the making. There was a back of my head that there was a need for this in our medical system for sure. Not easy to jump into it. It's sometimes a taboo subject. But we were doing procedures and certain things in the office that became impossible to do last year with some of the reforms in the healthcare system. The biggest one was the dropping of the accessory fees. So that with dropping of the accessory fees, we would not be able to do all that we do in the office. And basically it was either that or close down the office and not be able to offer all these well-needed services. So that was the straw that broke the camel's back.
And Roni, how about you?
Well, for me, like I mentioned earlier, I do a large part of my practice is laser surgery. And so already I was treating, various dermatologic conditions with laser, which is private and off Medicare. And so, like Andrew said, when all these reforms kind of came into play a little bit over a year ago, to me it was confusing what's considered covered under Medicare, what's cosmetic and out of pocket, and so I just decided to unify the practice.
Josh, we've spoken about this before, government making certain decisions, and then you have, people who have been in the government system with that entrepreneurial bug, using that decision as a means to sort of go out there and start a business.
No question. And this is a little bit different trigger. I mean, part of them is also giving back to their patients and wanting to spend that much more time with them. So that's definitely an important aspect, no doubt. Certainly our system. So as we move on to kind of the business side of it, you're out there, whether you're out there for the last 4 months or the last year, you got to have clients, have patients know that you are not part of the system anymore, that you are on your own, that you have the private practice. You have to start marketing yourselves. You have to start getting the word out that you are open for business in a slightly different aspect. What do you do first?
Well, this is, for me, the biggest change from going public to private, because when you're public, that patient flow is constant, and there's always patients, obviously, that need your services, and you're being referred from all your colleagues and other doctors. As soon as you go private, it's much more of a business, and patients are less willing to come to you. They know that they'll have to pay out of pocket for your services, and so advertising. I started advertising from day one as soon as I went private. Social media for me is very big. I do a lot of, I actually love it. I love posting about procedures I do, and I often will post lasers and injections and stuff like that
on
my social media. I love
dermatology,
it. I mean, it's fun. So that's what I love to do. So for me, it was an easy integration, but it was definitely a big change from when I was public and I wasn't doing any of that stuff previously. So that's a big change.
And Andrew, I don't know what urology pictures you might be posting.
I have great pictures, but I'm not allowed to post them.
We're radio. It's okay.
That's it.
So what did you do? Like, from a marketing standpoint, from the clinic standpoint, what are the thoughts that are going through
the first thing that I did was send a letter to all my patients. I think we sent out 8,000 letters, active patients in the last 5 years, saying that I'm going private. These are the services which I'm going to be offering. And if you don't want to go private, that's amazing. We will help you find. I'm in an office with 3 or 4 other urologists who are not private. We will transfer your files to them seamlessly. Same chart, same file, same office, easy. The other thing we went to is the top 100 GPs that were referring patients to me, sent them letters. And then, of course, we got into the social media. I'm not a guy who likes to get out there and doesn't feel 100% comfortable with this, so it took me some time to put my name out there, social media, and I would say the most successful thing for me to date bringing in new patients is Google, Google AdWords. It's people are searching, which shows me that people want the service. People are searching, people are looking for it, people are looking up urologists, private urologists, Montreal, and so on, and that's what's taken me so far. Now we're looking into phase 2 once we got over the initial hump. And again, learning from the last 4 or 5 months and trying to see where those patients are, because there's a need, just a matter of connecting with the need, and that's going to take some time to learn completely.
Now, private practice. What about pricing? You guys have to start and develop and figure out how much you're actually going to charge your patients. How do you go about that? What's the thought process?
That I mean, you can ask the people in the office, my office manager, the hours and hours and hours of discussions what we had, banging our head against the wall, trying to figure out, because you're not used to valuing yourself with a dollar sign as a doctor. So who's going to want to pay?
Do you look at your competition? Do you look at other private practitioners?
Urology, there's no competition. There's one other urologist across Canada who's done this, and he did it 3 weeks before me. So there's no one to look at.
Great, you get to be a trendsetter.
Yeah, well,
nobody's cheaper than me.
Some people say brave, some people say stupid, but.
And how about, sorry, go on.
Yeah, so we just, after hours of discussion or weeks of discussion, we came up with something and we said, we'll adjust it as we go. And so far, we haven't adjusted much.
And Roni, you've been doing this a little bit longer.
Yeah, so for me, I mean, I knew that I would kind of learn as I went along. So initially I did, speak to some of my colleagues that were private, and I know a few dermatologists that already opted out a few years ago. So after speaking to them, I kind of said to myself, you know what? I think I'm a likable guy. I want people to like to come to me. So I did set my price point a little bit lower compared to other people. But, I also feel like I want to be accessible for patients. So setting a bit of a lower price point in comparison, I thought would make me as accessible as possible.
Speaking of accessibility, location, did that come into play where you wanted to set up shop?
Well, I think when you start a practice, that's the most important decision is where do you practice? And when you're on Medicare, you take it for granted, right? You say patients are going to come to me anyways. But when you're private, I think it's even more of a consideration. That being said, I mean, I think that, like I think my patients, wherever I would be, they would come to me anyways because we develop that relationship over time. But for sure, location, parking, practicality is all important.
Andrew?
Well, my practice was already set up in the Elna Medical Complex on the Carry, so it's somewhat central. And but I guess when people want you, they find you. So I think it was important to choose a good place. But people are finding me from Gatineau, from Sherbrooke, from wherever there's a need across Quebec, they find it. So it's because of the nature of the practice and I guess the lack of competition, they find you from all around.
Real quick question before the break for you both. What is your best lesson as newer entrepreneurs after that transition? What's the one lesson that you learned?
Well, for me, I think, I always talk about this with my wife. You got to love what you do. And I absolutely love lasers, technology. I love making feel good about their skin, seeing results. And so being in the cosmetic dermatology world, I'm very passionate about it and I love it. And for me, I don't feel like it's work because I love it so much. One other thing I just want to mention very quickly, whether private or public, it's always about the patient. And I don't think that being private or public is as important as it is, and I know myself and Andrew both feel this way. It's always about what's best for the patient, ultimately.
Andrew, it's been a little newer, but do you have a quick lesson learned at the moment that you want to share?
Yeah, you got to have thick skin because there are some naysayers out there.
That's not the dermatologist talking, by the way. That's the urologist.
You have to have thick skin on other areas. You have to, as Roni said, like what you do, but you have to be good at what you do because these people are paying to see you and you want to be good to them and treat them well because they have friends and colleagues and doctors that they see that are going to help refer you back. Word of mouth is super important at the end of the day. I've been okay for 4 months now, but as I keep on saying, 4 months down, 20 years to go.
Urologist Dr. Andrew Steinberg and dermatologist Dr. Roni Munk will have their one piece of advice for today's entrepreneur on the way, plus FL's Nick Moraitis, tax partner, on implications during tax season for doctors and other professionals. That is coming up next.
For professional advice with a personal touch, consult FL Fuller Landau, Chartered Professional Accountants and Business Advisors. Click on flmontreal.com.
Inspiring stories from outstanding business people. Dan Delmar and FL Montreal's Josh Miller with you for today's entrepreneur. And joining us is urologist Dr. Andrew Steinberg and dermatologist Dr. Roni Munk. Their one piece of advice for today's entrepreneur is on the way. But first, we welcome back FL tax partner Nick Moraitis to talk about some of the tax implications for these doctors and other professionals. It is that time of the year. Nick, welcome back.
Hi.
How are you doing, first of
all?
all?
Not too bad. Very well.
And, there's really a lot of topics we can cover, Nick, but let's, we'll kind of talk a little bit incorporation. Should doctors still incorporate? And, certainly from a tax standpoint, the income splitting rules are a little bit out the window. So, wherever you want to start, go right ahead.
And when do I finish?
3 minutes.
The idea was for doctors, and this actually started, we think that was probably the problem as to why the Liberals came out with the policies, is that a lot of professionals started to incorporate. There was good tax reasons. There was good non-tax reasons to do so. For those who are investing in equipment, etc., financing could be easier with a corporation rather than owning something yourself and it's commingled with your personal assets. So I can see bankers would prefer corporations. You have employees, you want maybe to do it through a corporation. Over time, you can access an individual pension plan through a corporation. You can't do it otherwise, and that's a turbocharged RRSP, I call it. So there's good financial reasons to do that, but a lot of the tax reasons was what? You were able to split income with your family. Well, that's a no-go. If you were in the type of medical practice where you were able to sell the medical practice, it was a capital gains exemption. That's still available. And the third thing that you wanted to do is pay a lower level of tax for your total income. What you need to live on, you will pay the full 50-something% tax that the government needs. But what you don't need to live on, you can defer and accumulate wealth in the corporation, which the government didn't like either. So starting in 2018, if you have family trusts in your corporations and you have family members who do not work in your business, you cannot split income with them anymore. That's
But still for 2017, there is still a little bit of time left, 10 days left if you wanted to deal with the 2017 distributions from your family trust.
If it hasn't, if the family trust hasn't yet decided who, you have to decide as to and make it payable to the beneficiaries shortly. What
if your spouse was helping you or working in the
that's
business?
it. So if your spouse or child who's over an adult child is working in the business, the government's basically said, listen, if they're doing 20 hours a week on a constant basis every week, then they're considered to be contributing meaningfully to the business. You can pay them salary, you can pay them dividends. There isn't any of this income splitting issues. If they're not doing these 20 hours, they're doing something else, and it's basically whatever it is that they're doing, that's pretty much what you're allowed to pay them. And so that becomes a problem if their skill set, what they've learned, the spouses and the children, isn't very helpful to the doctor. Well, then there's not much you can do. The thing that, and then recently with the last budget that they finally came out was one of the beauties of corporations was the accumulation of wealth. This is how the last 50, 60 years Canadian entrepreneurs were accumulating wealth, was through the corporations. Savings, yeah. It's the monies I make that I don't need to spend on my business or on myself. So let's accumulate it in a corporate environment. Let's reinvest it, stock market, real estate, whatever it is that you want to reinvest it, and let that grow. It becomes a pension pot for entrepreneurs, and it makes a difference between trying to get it all yourself, paying 50%, or paying closer to 20 or 19%. Well, now the government's come in and say, okay, fine, we'll let you do that up to a point. And the point is, once you start earning, what was it, 50,000 of investment income. So if you've, say, you've accumulated $1 million of funds and you've invested it in real estate or a combination of real estate, stock market, etc., and you're making $50,000 from this investment of $1 million, what they start doing is they'll go back to your business and they'll start increasing the taxes on your business. So that $50,000 and $1, that extra $1 will be taxed anywhere between 80 and 90%. And that's what they're trying to do, because they figure that once you got to the $1 million, that should be enough. Now start taking out the money.
Not just doctors, though. We're talking about
any professionals and any business person, actually.
So, not always a lot of fun, but definitely rules you now got to follow. Thanks very much, Nick.
Okay.
And as we approach the last moment of the show, and we got a little bit of this earlier on, but we'll turn to Dr. Steinberg and Dr. Munk and ask each one of you, what would be your one piece of advice for today's entrepreneur? Andrew?
So I guess it's more than one piece. One, be good. I said this before. Be good at what you do. Believe in what you do and what you want to do. And be persistent. There's going to be stumbling blocks. If you fall, get up and keep going in the direction you want to go in and that you believe in.
Excellent. Thanks. And Roni?
I also said it before, but I'll repeat it. I think passion for me is number one. If you're passionate about what you do, you really believe in it, you never feel like it's work, you never feel like it's business. I mean, going to the office, I love what I do, I love cosmetics, and so I thrive in that environment because it's my passion.
And thanks very much, guys. And Dan, the quick takeaway that also Roni and Andrew said earlier is they really wanted to spend more time with their clients, their patients, and I think that really revolves or associates with any business and not just doctors. So that's always a huge important factor for any entrepreneur.
Urologist Dr. Andrew Steinberg and Dermatologist Dr. Roni Munk, thank you both for joining us this evening. And a reminder to listen to Dr. Roni Munk and Skin Deep, which is coming up Wednesday, 7 p.m. here on CJAD. Thanks to Nick Moraitis, tax partner at FL, and best of luck, guys, with this season, of course. Next week on the show, Josh.
Bad Monkey Popcorn.
Should be fun. Some good snacking next Monday night at 7 here on CJAD. Good night.